So I'd say there's two kind of variations of patients that present to me. One is with painless nodules or cords in the palm, so just thickenings of kind of the fascia that are under the skin in the hand. Not painful, they just want to know what it is. And then the other presentation is when those cords start to contract and they can make the finger go from being in a straight position to a bent down position over time.
Meaike usually says it is usually a clinical diagnosis. They often take x-rays to rule out any underlying arthritis or other issues. He says a common test called the tabletop test can determine if a patient needs any intervention to improve function.
The tabletop is the easiest to remember and easiest for patients to go home with, so that's kind of what I tell patients. If you try to put your hand flat on a table and if that finger just won't go flat and you're having symptoms or limitations, then that's when surgery is typically indicated. There are cutoffs and values for like the MCP joint or kind of your knuckle joint, 30 degrees when contracture gets above 30 degrees or more than 30 degrees.
Depending on the surgical route the patient takes, recovery time can vary.
Sometimes that cord is really intimately associated with the skin, and so we have to really thin the skin out to get the cord out, and that makes the healing process and the risk of wound healing complications a little bit higher, and so we'll go slower. But in general, it's just getting the skin to heal, and so a period of immobilization and some type of protective dressing and splint to keep the finger out straight so that we don't lose that motion, but also get the soft tissues to rest and heal. And so every patient is different, but usually on the course of weeks as opposed to like months or 9 months like you'd see for an ACL or something. Yeah. A lot of the times people just need reassurance that it's not something that's cancerous or malignant or something to worry about. So a lot of the times that reassurance is something I'm able to offer. But when it does kind of turn into something that limits you, just knowing that there are options to help out with those limitations, and it's not just something that you need to live with because it's non-cancerous and not something that's gonna metastasize elsewhere. So knowing that there are options